All right. Hello and welcome. This is Office Half Hour and approximately half an hour-ish deep dive into my thoughts on the current state of affairs of our industry of healthcare, as well as um, questions, answers to your questions. So, my name is Jessica. I am the world's most productive nurse practitioner, or so they say, and I am obsessed with time management and charting efficiency in the clinical setting, right? Because this is something that we just aren't taught. Charting unites us all. And yet, no one's really taught how to do it or how to do it efficiently. So, I want to be part of making our work world a better place to live. And that's the way that I'm trying to do it. That's my angle. So, glad that you're here. Glad to talk about things with you, with us, and happy to answer questions. So, if you have questions, drop them in a comment below. Shoot me a message. I read all my messages. I would love to hear from you and love to answer your question. Your question just might be featured on Office Half Hours. So, today I want to talk about streamlining. Streamlining. This goes along with empowerment, right? What? How does that make sense? Here's my thinking there. I'm talking about this through the lens of being a nurse practitioner because that is my clinical credential, right? So you may be watching this, you may be a physician associate, you may be a med student, you may be a physician, you may be a respiratory therapist, you may be a dentist, you may be who knows, right? Like there's a lot of different types of people in healthcare. Like so there's a lot of different roles. But I'm talking about this through the lens of being a nurse practitioner because that's my role. And I think that even if you are not a nurse practitioner, if you're watching this, you are likely going to be able to pick something up from this, right? Because it's not about being a nurse practitioner, right? It's not about like which boards should I take, which certifying organization should I be a member of the ANA? It's not about that stuff. This is bigger picture. This is more philosophical. This is more about an approach. And when I'm talking about streamlining and I'm talking about empowerment, that cuts across professional boundaries, right? I had a patient just this week actually who was having a dental issue. And I was like, we don't learn anything about dentistry stuff in school. Like really broad-based oral infection type stuff or treating a canker sore, but that's about it. Most of the stuff that I know about anything dental related, I know from my own personal experience because I don't have great teeth and TMI, but what I know is kind of from my own experience. But the point being, this is not about whether what's the best way to approach a dental infection or can she go to the emergency room for these sorts of things. It's not about that. This is bigger, bigger, bigger picture. And I don't need to know about how these other disciplines work because what we're talking about here is an umbrella concept. So, streamlining, how does streamlining have anything to do with empowerment? And the point is, we learn so much in school. So I feel like sometimes I come across as being really negative and like down on school. Like they don't teach us about time management. But they teach us a lot, right? Like, so again, like no matter whether you actually learn about oral stuff or not, we'll leave that for the dentists and the oral surgeons. Like there's a whole industry that does that. Whether I learned about that or not, I learned a lot, right? And you did too. We learn a lot in school, but there's so much to know. We really only learn like the clinical stuff. The professional development comes later. That comes on the job. And so I don't know if this is necessarily a shortcoming of our training, or is this a shortcoming of our workplaces and emphasis on professional development? Or is it just a gap that it's not even a shortcoming because it's not even getting addressed inefficiently? It's just not getting addressed at all. That is kind of maybe the most accurate way to put it, that it's just this gap. Um, Conferences, I guess, can touch on this, but again, there's so much to know, right? Like you're going to go to a conference, you need to get your pharmacology credits. So for your renewals, and you need to learn like what are the latest guidelines for managing COPD or diabetes or whatever chronic stuff. Or if you're in a specialty, you might need to learn how to use new equipment. You might need to learn how to do a cystoscopy if you're in urology or whatever, right? Like there's a lot of clinical stuff, even when you're done with school, that like it just keeps coming at you, right? So there's this sort of in between, this gray area, and as I'm wearing a gray scarf, perfect timing, for all this stuff that we just kind of learn or don't learn on the job. And I would call that, I guess, I would file that under professional development. And I think we need, for our sake, but for our patients too, we need to put more of an emphasis on this. I think that when we put more of an emphasis in intentional emphasis, not just trial and error, but really learning these things, we the way that it benefits our patients, it benefits us first, but our patients indirectly is by helping us to not get burnt out, to steer out of the skid that can be burnout. That is better for us. And by us having us in our professional roles at capacity is better for patients. It's better for the workplace, right? Because it's expensive and time consuming to hire a new person and to get them up and running and to get the credentialing taken care of. Like that's a whole thing. But if we can remain in our positions because we are satisfied, because we are not burnt out, and because we can effectively navigate the things that are coming at us, because it is always coming at us from all directions, then that is better for everybody. But I feel like too often we've put the focus on the patients and patient care. Undeniably, that's an important part of it. But if we're burnt out, you kind of can't have one without the other. So, streamlining is a topic that I think directly relates to this, and by having us feeling better, feeling more effective, then we are better for we're more present for our patients, we give better care, we have better patient outcomes, better chances for better patient outcomes. So, therefore, I want us to think about streamlining and to think about what we do, how we do it, and how we might shuffle that in a way that benefits us. And that I'm a nurse, so I love prevention in a way that prevents burnout or reduces the risk for burnout, because the public health person in me loves risk reduction, harm reduction, right? Like looking at it that way too. We can apply those same principles to the way that we get through our workday. Absolutely. Clinicians are a population, so population based care applies to our work experience just as much as anything else. So think about what you do in a day, in a typical day, a typical week. You can look at this prospectively moving forward, right? So you can say, okay, for the next 5 days or the next whatever your normal work week is, if you're 4 days, 3 days, whatever it is. But for the next normal work week that I have, I'm going to have this thought. I'm going to keep this in the back of my mind, in the back burner. What am I doing? And what are some things that I could either do differently that are completely up to me, but I could kind of approach differently that's going to make it a little smoother, or that I might be able to give away, right? So I'll give an example. If you do PAPS, right? If you do women's health on any level, so this could be in a women's health, like an OBGYN setting, or this could be in primary care, whatever the case, it could be in the emergency room, whatever the case may be. If you do PAPS, it's a, it's a procedure, right? And there's a few steps to it. How I go about it. I want the patient undressed before I go in the room, okay? Because it is more efficient. So I would like them from the waist down. I mean, they can leave they can leave everything from the waist up on, but put a gown on so that they are covered. I'd like to have a sheet over their from the waist down as well. Again, it's really more like a dignity, modesty thing. If the patient doesn't want it, that's fine by me. I know what I need, right? But I like to offer that. So I like to have that available for a patient. So from the waist down, I'm going to need everything off. They can keep their socks on. They can keep the shoes on if they want to, because the floors are gross a lot of times, right? Um, but I need to have that pelvic area undressed, gown, and sheet over the lap. and I'm going to talk to them. We're not going to get right into the PAP, right? But we're going to talk. We're going to do the rest of our visit first. And then when the time comes for the PAP, then we will get down to business. I like to have everything on my Mayo stand laid out already. If I'm really having a great day, one of the speculums, the plastic specs, I love those because they're not cold, they're not as cold. Plastic spec with the cordless light that goes in the base. Those things are awesome. If you haven't seen them yet, check them out. They're awesome if you do PAPs. And so I like to have that ready to go. And I've got my gloves, I've got my lubricant, I've got my thin prep file, and I've got my brush because I use the little brush. And I go in, and when it's time, now we're doing the PAP, I help the patient get up onto the exam table verbally, unless they need physical help. I do that too. And then here we go. And I ask them, do you like to know? Do you want me to talk you through this? Do you want me to just tell you when it's done? Go either way. And then we do it, right? And then I've got everything I need. Then she can, okay, we're done. Have a seat, come back up to your regular seated position. I've got everything I need. I've got my label is already good to go. It's on my thin prep file. I do my throughout throughout the brush, put the cap on. That's set. I wrap it in a glove because that's what I do. Because I learned that years ago. Wrap it in a glove. And to me, that signals that I'm done. The PAP is done. Okay. There's no question. The cap is on tight. I put it in a glove and it's ready to go. I don't leave it in a glove, but like that just is how I do it. But I have definitely worked with like new MAs who will leave the everything on the counter. No, please put it on the Mayo stand so that I can just pull it right over to the exam table when the time comes. And I like to have it covered as well so that the patient doesn't see that when they walk in. It's just a nice thing, I guess, that I do. So lay everything out and then put a drape over it. And then when the time comes, then we take it off and we get down to business, right? Have my light in my spec, please. And that is something when they are preparing the visit and they know that this is going to be a PAP visit, they can do all of that. They don't need to ask. There can be a checklist, or if you've been working together long enough, you don't need the checklist anymore, but they don't need to ask. They know what the need is. They know exactly what I want. And I don't need to do any of that. I don't need to get the patient undressed and then step out, stand in the hallway for a couple minutes or go back to my office and try to do something real quick and then bounce all around. No, I've streamlined it. And that's what works for me. That exact setup might work for you or it might not, but you should think about like, what's your version of that, right? Like if you're doing a PAP, do you want to do the PAP first and then have a conversation with the patient? Or how do you want to go about this? Do you want to have the patient fully dressed and then have them step out while they get undressed and then come back? That might work for you. That's not the best fit for me. But the point is, think about what does work for you and ask for that. It's that simple. And that's empowerment. And that is you showing up in the driver's seat of your career, of your day. That is the opposite of simply reacting to whatever happens or doesn't happen, risking burnout as a result, and really sacrificing yourself instead of working with other folks so that everybody kind of can get at least some of their needs met. The patient, whoever's assisting you, right? That is leadership. And when you do that, you're demonstrating, you're role modeling leadership for the folks that you work with, indirectly for the patients. When you know that things are going to be set up the way you prefer or need them to be set up, when you go into the visit, you have that much less stress and you can be that much more present for the patient or whatever the case may be. It is such a relatively small thing that it's pretty high yield, right? It pays off in so many ways. So move through your next clinical week and like, what's your PAP, right? Like, what is your thing that's like a little bit different than a typical visit, right? Or if you see diabetic patients, do you always want their shoes off before you even walk in the room because you're always going to check their feet? Things like that. What are yours? Like, what is your diabetic patient with the shoes off? What is your PAP protocol? And how are you doing it currently? And think about whether or not that works for you. If it works for you, great. Like you're ahead of the game. You're already doing this. Look for other opportunities where you can make that change. But if what's not working for you currently, or if the way that you're doing it now is not working for you, What are the small shifts? I always like to start with small shifts because they're more likely to happen, and then you can build the momentum from there. But what are, like, small shifts that you can make that's going to make it work better for you? So if I were to work in a new practice today and I were to be doing PAPs and they didn't have the patients get undressed first, that's a relatively small shift that I would ask for. And that would make a big difference to me because it would throw my rhythm off. It would throw off the rhythm of the visit. It would kind of like my head would get a little turned around. I mean, I would still be able to do the PAP, but like I'd be running late and it would be a little bit of stress in that visit. So I would ask, can we have the patients undressed and undressed from the waist down? And, here's how I do it. And have everything laid out. I don't want it in the drawer. I want it on a Mayo stand. That's completely fine. You're allowed to ask for that. The buck stops with you. If the buck is going to stop with you for all the other things that happen in the visit, isn't it logical? Isn't it reasonable that you should be able to ask for some of these things that are going to make it easier for you to do what you do? I think it's completely reasonable. You can ask for it very nicely. You can ask for it very bluntly. I don't know. That's up to you. That's your style, right? You fill it in, work with that however works for you. But the point is that we think about first what we need. We identify what those particulars are that we need, and then we come up with a plan to ask for them and to adjust if what we ask for isn't working or isn't we thought that would be the ticket and it's kind of not, so we need to do it a little bit differently. That's completely fine. I mean, that's science, right? That we're always reversing ourselves when we get more information, we try it and then we say, "Oh, you know what? We need to shift it just a little bit more." It's the same thing. You're using that same scientific kind of approach to just the way that you're going through your day. And you're doing it so that you can be empowered. And you're doing it so that you can continue to be the excellent clinician that you are. You can continue to be there for your patients and you can continue to be there for your employer. And you can avoid burnout. You can avoid quitting your job. And you can avoid them having to find a new provider, whether them is your employer needing to find a new provider or whether it's your patient needing to find a new provider, right? So there's a lot of benefit to this. And if you pick just one thing, so your version of the PAP, and you look at how you want to shift that, once you get that to the place where it's like rolling the way you want it to, you're going to find other stuff. Guarantee it. You're gonna find other stuff that you're like, "Well, you know what? We were able to make that change, and it worked. What if we made this change? What if we made that change? If I have a patient that's coming in with urinary frequency, I want you to get a clean catch on them before I even walk in. You don't even have to ask. You can put the order in, I'll sign it, right? Get the clean catch, dip it, and I probably want the results of the dip before I even walk in. So I'm kinda going in with the deck stacked a little bit, right? Those are all completely reasonable, completely benefits everybody, and also does, in that case, empowers the nurse or the MA that is bringing your patients back because they know, they can see that and they can jump on that. They're gonna have to get the clean catch anyway, right? It's easier for them if they can go I think, if they can go all the way through that protocol, get the clean catch, bring the patient back, finish doing their med rec or whatever else they have to do, get the vitals before they're done with their part of the visit, and then they can move on to the next patient that they're bringing back. But they're also able to work it to, like, the maximum of their licensure, like, that's a good thing. That's leadership. That is empowerment to them. When we take these steps, I think, when we take these steps to make our day-to-day better, this probably sounds a little bit like, like a little too Pollyanna, and that's not me, but I guess maybe it is me a little. I don't think it's me. I guess that's for you to say. But when we take these steps to empower ourselves and to make our day-to-day better, it radiates out. It benefits other people. In the workplace, it's gonna benefit your colleagues, your immediate people that you work with. It's gonna benefit your patients. It's gonna benefit your employer. When you are feeling more empowered and you are feeling better about your 9 to 5, that's going to make your 5 to 9 better. That's going to give you a different amount of energy to approach your relationships, right? Outside of work, your social relationships, your family relationships, your hobbies, all of these things. It is this the kind of the first point of this chain reaction. And it can be something as simple as streamlining certain things that you do all the time so that you're eliminating waste, so that it is working in a way that benefits you and that you feel empowered. Try it. Let me know how it works for you. Let me know if you have questions. Let me know if you have questions about this, whether you have questions about just like other stuff in general. Shoot me a message, drop me a comment. Take a look in the comments below for some other exciting things that I have going on and other ways that you can get a little extra support, a little bit of guidance, a little bit of feedback if that is something that you are looking for. Otherwise, I will see you next time. Take care.